Let's talk about micro-lab explorations and mastering microbiology. We start with learning objectives and a real-world scenario. In gram stain, we're asked to identify the potential cause of a 7-year-old girl's urinary tract infection. We have decision point knowledge checks along the way. Students see clear instructions walking them through common lab procedures.
Cover the smear with crystal violet for 30 seconds. Wash the slide carefully with distilled water. Let's look at what happens at the molecular level when crystal violet is added to the smear. Crystal violet penetrates the cell wall and cytoplasm.
The next video explains the function of Graham's iodine.
Cover the smear with Graham's iodine for 10 seconds to 1 minute. Your instructor will advise you on the required time based on the reagents used in your lab. Wash the slide by letting distilled water wash over the smear. Wash the slide until the water runs clear. Let's look at what happens at the molecular level.
Moving on, we see how decolorization affects the stain. We'll skip that video. This decision point is one of the hallmarks of microlab explorations and likely a common problem in your own lab. Students commonly over or under decolorize. They can make that error here, deal with the consequences, and learn from their mistakes. We will make a mistake so you can see that. As we play this video, we're asked whether we've decolorized enough. Click stop if you think we're done, or continue to decolorize more. As that finished, I actually still see some purple being rinsed out. We really should keep on decolorizing, but let's make a common error my own students make. I'll click stop to move on to the next stage of the process. This video shows on a molecular level what safranin does as a counterstain. I'll let you watch that later. The real story here is the microscopic image the student sees who's just under decolorized. The control slide with a mix of gram-positive and gram-negative is entirely purple. That's bad. If the student answers that the patient has gram-positive rods in her urine, we get some critical feedback about what a control is supposed to look like and a reminder that we probably under-decolorized. We're told to start over and brought back to the decolorize step. This time, I'll say continue to keep on decolorizing. That appears clear. We will stop decolorizing. And at the next step, our control slide looks as expected. This time, I'll report with confidence that the patient has gram-negative rods in her urine. We're then asked what might be an appropriate antibiotic based on the results of our gram stain. And our boss tells us that we did a great job for our young patient. These work great as a pre-lab tool, as a post-lab assessment, as a refresher for students who need to review a procedure, and even as a potential lab replacement.